Hello and welcome to Ask Dr. Gupta. In our previous videos, we have discussed breast cancer and other problems of breast like breast pain and non-cancerous breast lumps in young ladies. Today we shall discuss another problem which is quite common and irritating, that is discharge from nipple. Discharge means fluid coming out from one or both the nipples. It is a very common problem, especially among the middle-aged ladies. It is taken as abnormal only if it comes by itself. That can be indicated either by staining of the undergarment, or it might be visible coming out from one or both of the nipples. Otherwise, if we use pressure or breast pump, then some fluid can be extracted from about 70% of breasts. One thing is to be understood that it is not always necessary to take treatment for nipple discharge. For example, during pregnancy and during lactation, some discharge from nipple is normal. Discharge might continue after cessation of breastfeeding for some months. It generally settles by itself. It can be non-serious discharge if it is clear, it is white, or it is greenish in color. Generally, if the discharge is coming from both the sides, then it is not serious. However, a discharge coming from one side only needs investigation in most of the situations. The non-serious causes of discharge can be hormonal changes like during menstruation, some medicines like birth control pills or antidepressants. Sometimes a non-cancerous cyst in breast can also be reason for a nipple discharge. If a lady has discharge from nipple, then it is better to meet a doctor once and ensure that there is nothing serious underlying that needs to be managed. Breast cancer generally does not present as discharge from nipple. Remember two things about nipple discharge. First, if there is a tinge of blood in nipple discharge, then it is always serious, must be investigated, meet your doctor immediately. Similarly, any discharge from a male breast, irrespective of its color, irrespective of its quantity, is to be taken seriously and is to be investigated further. The pathological reasons for nipple discharge can be infection in breast. It can be an injury to chest wall. It can be because of a tumor in the pituitary gland. Thyroid problems can also cause nipple discharge. Sometimes there is a small tumor in the milk channels of the breast. This tumor is called papilloma and it can lead to discharge, which is many times blood stained. Breast cancer is among the rare reasons to present as a nipple discharge. When you visit a doctor with a complaint of nipple discharge, then the aim of the doctor is to rule out any serious underlying condition. The evaluation is generally done either with ultrasound of the breast or with mammography x-rays. Nipple discharge fluid might have to be sent for pathological examination to look for blood in it under microscope. Efforts to see cancer cells in a nipple discharge fluid are generally futile. If a discharge is blood stained, then you might have to undergo a small operation which is known as microdocectomy. In this operation, the channel that is causing blood stained discharge is identified and the entire channel system is removed surgically. The removed tissue is sent for pathological examination. The pathologist will be able to see that papilloma which is causing the nipple discharge and it is blood stained. In some rare situations, there might be a very small cancer lying there which is causing blood stained nipple discharge. If the discharge is non-blood stained and it is problematic, it is pathological. In that situation, sometimes something as simple as change in ongoing medication might solve the problem. The person might need antibiotics to control infection. If there is collected pus, then that pus might need drainage. Non-cancerous cysts which are causing discharge might have to be removed surgically. If there is nothing serious, then you might be asked to stop squeezing your nipples and to leave it alone. So we understand that nipple discharge is a common problem, but it is a manageable problem. Generally, it is not a signal of underlying breast cancer. So please meet a specialist doctor and get rid of this. In our series of previous 6 videos, we have discussed breast cancer in detail, in great detail. We have discussed breast pain and non-cancerous breast lumps also. Today's video brings our discussion on breast diseases to an end. Please stay connected with us for discussion on other cancers. My teleconsultation number is mentioned in description. In case you wish to suggest any topic to be discussed, please write a mail to us on the email address mentioned in description. With all this, I wish you all a very happy and very healthy life. Thank you.